We'll go ahead and call the meeting to order. Good afternoon to everyone, and we appreciate you being here. And I think we have some pretty significant progress to report to you today. We're beginning to see some common themes, I think. The current system, the infrastructure, is an effective model. In other words, with central office providing overarching administrative functions, legal, communicable disease, accounting. But there is a need for local control so that counties can make decisions based on the community's needs. The state plan needs to be developed from the ground up and allow for flexibility of delivery, public health delivery services based on local needs. There's a strong desire for improvement in information technology infrastructure, and that's both financial and programmatic as well. A lot of people don't know the value of public health. And as we know, we're talking about that realm of public health. The upstream causes of poor health is really going to be responsible for about 70% of the opportunity to improve health in our state. Since public health deals in prevention and in health and wellness, that's an excellent investment because that will lessen the amount of resources, healthcare dollar resources that it will take. Also, messaging around the idea that public health and wellness is one of the critical supports, one of the three critical supports for public health to have a vibrant, healthy state. And those three legs would be education, health and wellness, and jobs in the economy. The main takeaway that I receive from listening to folks is that they're ready to move forward in a positive way.
The system is not broken, but we just need to tweak it a little bit. County health departments and public health are very important to the rural Oklahoma, at least the feedback that I've been hearing, and certainly in the time that I was there. So marketing is key. How we market public health is in different the way maybe the metropolitans market public health. We always used our service, our vaccines, and other ways to make sure that health departments were visible to the communities we serve.
If we could kind of rally around common language, so when we start throwing out decentralization, that means something. Regionalization means something completely different. And I think also the benefit of going out to these listening sessions, it gives everyone an opportunity to become more informed or more aware of what goes on in the county health departments.
I think Brandy's exactly right. Some of the language we're using as public officials in all realms, whether it's elected or not, we've got to change that language. We've got to talk about our cost of health care being driven by poor health. It's not because we have too many agencies. It's not because we pay for too many people. It's because we aren't healthy as a state. And how do we change that narrative? So I will work really hard with my colleagues to change the way we talk about things.
We have learned over the last 10, 12 years the data and the passion that has come from the county health departments and how they serve their communities and the needs of their communities. So I really look forward to the information that we receive from our regional directors about what works.
There's a lot of people that are working really hard to find those efficiencies, those synergies, those improvements, and it takes a lot of effort. So I think that our responsibility is to really pay attention to that, to those recommendations, and not just be another report on the shelf that just gets stuck somewhere. We need to take this very seriously, and we really need to take in some of those recommendations as opposed to just be in another report. I long to see the day where we start investing in our resources in our community to grow it organically as opposed to acquisition.
So for the first time, I think in a long time, we're starting to see movement throughout the public health system, and movement in a very positive way. We were dissatisfied about where we were, and that's the common ground we finally found to come together and start to focus on the one thing, and the one thing is that how do we create a system that serves all Oklahomans fair and equitably and does what needs to be done at the right time? And
we don't have to recreate the wheel. We just need to make the wheel, grease it really well, and use it. And So I'd like to see a lot more innovation at the local level and not come up the central. We don't need a big central government, a big Oklahoma government. We need to get out to where the people are and deliver our services to the people.
It's our belief that making the information available, not just in the central body, but also to get it out to the places where it's needed to make decisions is very important. Gaps in our public health infrastructure, one that came to mind, came to the surface initially, was about disease surveillance. It's a pretty basic part of life in modern America, where we have the threat of things like bioterrorism on top of everything else, to be monitoring for disease that might walk into our emergency rooms, outbreaks that appear in clinics. And Oklahoma and Tulsa counties have their own internal structures for doing disease monitoring and surveillance from the health facilities within their counties. But it turns out that the rest of the counties in Oklahoma don't have such a service covering them at this moment.
Almost all of you mention the importance of communication and the misunderstandings and the misperceptions around what is public health and why is it important and how does it impact everybody. And that's kind of our second mission, I think our group believes, and we're going to start focusing on that today pretty intently. Our plan is to come up with what I would call sort of the elevator speech or standard way of describing what is public health, how does it impact everyone, and so that our messaging can begin to become somewhat consistent.
I kind of just want to talk about the process. We were wanting you to know what we're doing to arrive at some recommendations, because when you look at budget and programs that are directed at improving the state of health in Oklahoma, it encompasses so many pieces that you can get lost in the detail. And basically, when we're looking at this, the foundational areas that are in the rectangular box, and I think that Director Cox talked about this before, but if you don't have those foundational public health services and those foundational capabilities, then you're not even meeting what is considered to be the minimum expectation for public health. So we're trying to keep this on the forefront of our minds as we are moving forward. Models, research, things that we can use to guide and align ourselves with to make ourselves the greatest state in public health in the nation.
We felt like in our initial meeting that we really needed to highlight where we are as a state in this country. We are 43rd. We are not really improving the way that we should. What should we be doing better so that we can improve our overall state ranking? Those counties that are ranking the best in our state, that rank between 1 and 19, there are 19 counties, unfortunately, the dark green color, that are ranking poorest in our state. And so we have to look at how do we strategically do it better and incorporate some of maybe our public health best practices or model practices to improve those counties, therefore possibly or potentially improving our entire state. And now the time is right for us to figure out how to do the right thing. And so if we want to improve the health ranking of our state, this is the time to do it. And I think all of these committees working together and presenting information to the Joint Commission, we're going to be able to get to the right place. Because ultimately what we want to see happen is that people in our state live longer, live better quality of lives, live with a sense of health and well-being, and ultimately do not die prematurely. In order for us to do this work, we have to look at other states. And there are a number of other states, of course, that are doing better than we are. We know that there is not a mirror state that looks just like Oklahoma. But we can benefit from looking at states that look similar to Oklahoma, that may have a rural-urban mix, that have a similar population, that have a similar per capita spending, those types of things.
This is going to be a challenge, but we feel like we're up to it, and we appreciate the opportunity.
There simply are not resources there to provide those foundational services, public health services. They're just not there. And so we've got to figure out some kind of a way to push some resources in those directions, because the basic premise is that everybody in Oklahoma should be entitled to that basic set of services to protect and improve their health. Thank you very much. We stand adjourned.